I'm going to go use a knee model to show you how chondromalacia often is associated with patellofemoral pain syndrome or tracking issues of the patella. So a lot of folks, when they bend their knee, so this knee's bent, the patella will track off to here. So that way, when they straighten their knee, there's like a clicking sound. Like in other words, the patella here is going into this groove called the trochlear groove of the femur. So if the patella is not tracking correctly, the kneecap's going to wear just on one side. So you can't just do prolotherapy on the inside of the knee with the hopes that you're going to get some cartilage repair of the kneecap. You actually have to help also the tracking. That's where exercise and physical therapy to strengthen the vastus medialis, which is the muscle on the medial side of the knee. So there's various exercises that people can do for that. What we do at Caring Medical is we do comprehensive prolotherapy on the medial side of the knee to pull the kneecap this way. Also, if there's hypermobility, like you could see here, here's the medial collateral ligament. So somebody could have instability caught because of injury of that. So we'll do prolotherapy to that to resolve that part of the chondromalacia. Now, some folks say, well, why should I trust you? Well, it turns out, we accumulated data on 69 patients with chondromalacia patella. Interestingly, 16 of those, the doctor wanted to do surgery. Of the 16, after the prolotherapy, only 3, still were surgical candidates. So that was kind of one of the things we found. The other thing that we found was basically when it was all said and done, around 95% or more of the patients either had no pain or minimal pain. They were back to basically exercising full out. And those are great results because basically the athletes came here, they weren't exercising very much at all. So we got almost all the athletes, back to exercising, basically without restrictions. The other thing, how objectively that the prolotherapy objectively did something beside just the athletes getting back to running and all the sports that they do, is that grinding sound and that clicking sound almost always goes away, or it mostly goes away, and the study that we did actually showed that also. So, so it wasn't just subjective symptoms, it was actual objective things that the person could see themselves. So definitely the article says that, prolotherapy, it should be considered first line, not second line or third line. First line, if someone has, especially an athlete, has been diagnosed with chondromalacia patella, definitely would recommend prolotherapy.